No matter your age, or if you're on a competitive sports team, or maybe you just enjoy friendly games of pickleball or golf, injuries, they can happen. Dr. Steven Bokshan with Cone Health OrthoCare is talking about how to prevent those common injuries. So, hey, let's start with pickleball, since we know so many people are on the pickleball wagon. What are some of those common injuries, and what should pickleball players do to help prevent those?
Yeah, we see a lot of pickleball injuries these days. So most commonly what we'll see are the typical sprains and strains. Ankle sprains, believe it or not, are very common. But one of the most common injuries I see, believe it or not, is actually fractures. So what I would advise all of my future pickleballers to do is please get your bone health checked out. Go check to see if you have osteoporosis, either at your primary care doctor or here at OrthoCare. We also do osteoporosis screenings. Please, please, please.
Yeah, and that's a non-invasive screening, and it takes all of like 20 minutes.
Absolutely. Quicker than an oil change, and it can save you a potentially devastating fracture that could keep you out of the game for a couple months.
Okay. All right. So let's talk about stretching. I know people who have played pickleball and who have said, oh, that was my first mistake, is that I just didn't stretch before I played a game and then I hurt really bad.
Yeah. Stretching is essential. So especially for my pickleballers who are getting into a sport, they may not have been in a sport for the last couple months or even years. Stretching can save you a very bad strain that can keep you out for weeks. So muscles that are cold do not like to get into activity. So a lot of my back strains or lower back, even neck strains, I'll see in patients who are not warming up appropriately.
All right. What about if you're just like starting a walking regimen? Should you be stretching before that too?
Yeah, no question. I mean, when it comes down to it, a lot of these things depend on the type of weather that you're exercising in, how recently have you exercised. The body in motion likes to stay in motion, and a body at rest likes to stay at rest. So the reality is that pretty much anything you will not do harm by doing a short stretching routine, but just play it by ear, make it commensurate with the amount of activity you're about to engage in.
Okay, and what about like tennis or golf? About the same kind of things that you would say for that as well?
Yeah, so in terms of tennis, believe it or not, it's kind of like pickleball. It just puts a ton more stress and force on the shoulders and elbow. So what I tell you, if you're going to engage in tennis, you got to do your stretching, and not just stretching, strengthening. So that's when I'm going to see my shoulder injuries, my elbow injuries, things like tennis elbow. Those are chronic repetitive overuse injuries from just high velocity sports, and really in response to not doing an appropriate kind of stretch or inappropriate strengthening, particularly of the shoulder. Golf looks low impact, but believe it or not, it's actually a quite impressive sport in terms of the amount of rotation you put through your back and spine. So for all of my golfers, I tell them, please, please, please work on your lower back, work on stretching your back, work on stretching your hips. You will thank me on the back nine.
Yeah, so I was about to say, what happens if like you don't do the warm up or the stretching? Will you feel it then, or will you feel it later?
Typically, so that's a great question. Typically, if you have more of a significant injury, you're going to feel it pretty quickly. So when I say a significant injury, I'll mean something like a herniated disc in the back, or a more significant kind of flare up of arthritis in the back. You're going to feel a sharp pain, and it's going to really stop you from finishing the round. Now, a muscular strain or sprain, that's something that will kind of crescendo or build up over the course of the next several days. And that's something that's a little bit less acute and may not necessarily need a workup.
All right, and when we talk about stretching or warming up, you've always heard all these things, you're not supposed to stretch, unless you have warm muscles. So what should you do?
In terms of stretching, there's lots of good stretches that you can do. Believe it or not, a lot of the stretches I advise are actually pretty consistent with what a yoga teacher might give you. My go-to for stretches are a therapist by the name of Dr. Joe on YouTube, but you can find sports-specific content for just about any sport you'd imagine. All you have to do is head to YouTube, for example, and type in a quick golf stretching exercises. And what you'll do is you'll find lots of content that are specific for you there. But surprisingly not, a lot of what you're going to find is something that you'd find in a yoga class.
We've talked about what you should do if you're trying to warm up for pickleball or golf or tennis or any of that kind of stuff. Let's talk about what happens when you are sore. With any kind of sports activity, that might happen. So how can we differentiate between soreness that really can be treated at home and then like a real more serious injury?
Great question. So sharp pain that does not go away, gnawing, achings, things that wake you up at night, those need to be seen by your doc. Soreness, so what I mean is more kind of subtle soreness, a little bit of, discomfort, but not pain. That's something you can keep an eye on for a couple days and just do some treatments.
All right, well, let's talk about that. Let's talk about the at-home treatments that people can try that will give them some relief.
Absolutely. So our old friend rest, ice, compression, and elevation. Nowadays, there are lots of interesting ways to get those things done. In terms of ice, you can consider buying a cryotherapy machine if you want to be a little bit more advanced than the old school cold pack. Compressive wraps, sleeves, things like that are really helpful for sore muscles. Heating packs, all of those things go a long way.
All right, and when do you know when you should use ice versus when you should use heat?
Yeah, it's a really good question. So, think of a muscle as kind of a living and breathing thing. So heat tends to loosen it up. Cold tends to get it a little bit tighter. So you're obviously not going to want to apply any type of cold therapy before you want to get going for an exercise. So cold is for after exercise when you really need to cool down the muscles and take down the inflammation. Heat is really for those sore muscles that may be knotted up, that are fatigued, maybe overused. That's when you want to get heat on, when you want to get them nice and loose.
What about those like disposable heating pads or muscle rubs?
Yeah, muscle rubs are amazing. So BioFreeze, Icy Hot, there's plenty of Tiger Balm. There's plenty of different preparations for that. If you ever have a question about which one might be right for you, our friendly therapists at any of your Cone Health pharmacies will be more than happy to explain them to you. But yeah, those are great topical applications for sore muscles.
Okay, with school starting back, all kinds of sports that kids might want to start playing, how important is it to get a sports physical before your kid goes out for tryouts?
Please, please, please get a physical. I promise you, we will not bite. 99% of the time, the physical will be super benign. There will not be anything that comes up. It is the 1% of patients where we might detect something subtle, like a heart murmur, that really needs to be evaluated and can honestly save a life and has saved lives before.
All right, and we're talking about kids because they change and grow and this, that, and the other. Adults, we think we know our bodies, right? Do we really need to go to a physician, or when would we need to go to a physician if we wanted to start some kind of new activity?
I think the reality is most adults are already seeing their GP or primary care doc about once a year. And I think that appointment is more than adequate. I mean, if you feel like you have a nagging muscle ache or something that won't quite go away, or even an injury that you haven't been evaluated for, I think that would be a good time to see a musculoskeletal specialist. But aside from that, I think a visit with your primary care is more than adequate.
All right, we got about a minute left or so, so this is your chance for like all your final thoughts on what do you want to make sure that we all take home?
I would just say that motion is medicine. Stay active, keep moving. Doctors are meant to help you to do so. Doctors are not supposed to tell you to stop moving. So when in doubt, come see your local friendly orthopedic surgeon, but please just keep moving and keep being active. It will make all the difference and provide just for a graceful kind of aging process.
And it's okay if you're not, I think when people think, oh, I have to get active, they think, okay, I have to walk 5 miles today. And that's not where you have to start.
To be honest with you, that's one of the biggest complaints I see from friends, family, patients is just, hey, I tried to overdo it and all of a sudden I have 10 new things that hurt. The reality is that some exercise is better than no exercise. A walk 2 minutes on the treadmill is a great place to start. And it's nothing that you need to feel bad or ashamed about. When I see any of my patients at the gym here at my building, I give them a high five and I say, hey, keep it up, because that's pretty impressive.
Nice. All right. Thank you so much for your time and expertise. Maybe you need to send this to someone that you know, a family member. This is going to be in the 2-year well-being section of our website.